Good day, students. Today I want to show you an three-dimensional app. This one is called Essential Anatomy and it's the 5th edition. It's available from Apple iStore and Google Play. This specific app, I'm just going to put the skin on, shows you the human body and it shows you the musculature, arteries, veins, nervous system, connective tissue, digestive, all the different systems, and you can add and take off as you wish. For instance, we can take off the skin. This is very nice to have a three-dimensional visualization for anatomy if you are going to work from home and we are not going to have a full body dissection. Have a look. There are some free applications around. I will also make some short videos of the specific app that I am using now. So at the moment we've removed the skin and we have the musculature intact, and I want to show you an intercostal space today. So what I'm first going to do is I am going to remove all of the muscles so we only have Mr. Skeleton here. Now we can zoom in and work our way towards the intercostal space. Now, the costals are in fact just a rib. So this is our first rib. This is called, it's quite a flat rib, so it's not what we would call a standard rib. There is the second rib, third rib. Now, if we are talking about an intercostal space, we are talking about the area between two ribs. So the area above the first rib is supracostal. The area below the 12th rib is infracostal. This is the first intercostal space. The area between rib 1 and rib 2 is called the first intercostal space. So if we turn our little skeleton towards the back, you can see I've highlighted in green the second rib. The first rib, again, articulating with the first thoracic vertebra. Then we have the second rib articulating with the second thoracic vertebra. So it has a joint. It's articulating, so forming a arthrosis, a joint with the vertebra posterior. On the anterior side of our ribs, what we cannot see here at the moment, that's not been included in the drawing, is the cartilage. So I've added connective tissue now so that you can see. Here is the cartilaginous joints formed between your ribs and your sternum. Anteriorly, your sternum is formed by a manubrium, a sternobody, and a xiphisternum. So this is our intercostal space here. Okay. So in total, we will have 11 intercostal spaces. Right, so what do we have in our intercostal space? Let's add some nerves, we add some arteries, we add some veins, and now I'm going to add some muscles. I'm going to add all of the muscles, so I'm just going to take some of the anterior thoracic wall muscles away because we want to see an intercostal space. So here we have an intercostal space. First we have our external intercostal muscle layer that runs from diagonally from superior to inferior in the midline. Then the internal intercostals run in a different direction. They run from superior medial or superior midline towards external or lateral inferior, like that. So if we take away external intercostal. We can see the internal intercostal rib space there. Now we hide that. We also hide our external oblique muscles, and we have the third layer of muscle inside our intercostal space, or the innermost intercostal muscle. Importantly, here we can see a nerve, an artery, and a vein in this space here. So between the second and the third layer of muscles in our intercostal space, we will find what is called the neurovascular bundle. Basically, it means that the artery, vein, and nerve that supplies and drains this specific area is found in that layer between the internal intercostals and the innermost intercostal space. Right, I think that is enough for today.